Hi, my name's Beth Shook, and I would like to talk to you today about the drug that's known as PrEP, the pre-exposure prophylactic medication, and it's also known as Truvada. It's being used to prevent HIV transmission. It's a combination of two drugs, amitriptyline and tenofovir, and they work by blocking an enzyme called the reverse transcriptase. Reverse transcriptase is used by HIV to copy its genetic material and reproduce in the body. The PrEP medication, in addition to suppressing HIV in people who've already been infected, can prevent the virus from infecting people in the first place. It was approved for use by the FDA in 2012, and it's the first drug that's been used for prevention of HIV in negative people from getting HIV through sexual transmissions. PrEP participants must strictly adhere to the daily regimen of one tablet. This is in order to build up the combination of the two drugs in the body system. This will have the best results. Researchers from UNC Chapel Hill have published an investigation that shows vaginal, cervical, and rectal tissue all respond differently to PrEP. Colorectal mucosal tissue concentrations of tenofovir and emtricitabine was 10 times higher than that located in the lower female genital tract. This prompted them to state that adherence to 6 to 7 doses is necessary for a female to provide protection from HIV transmission. Colorectal tissue adherence states that they need 2 to 7 doses per week. Studies are being performed at this time now to study the effects of this medication on males, females, men that have sex with other men, IV drug users, and adolescents. With the availability of this medication, one question that has come up has been, will this medication promote riskier sexual behavior? One prominent advocate for AIDS research is the AIDS Healthcare Foundation. Their president, Michael Weinstein, has called PrEP Truvada a party drug that will encourage risky sexual behavior due to patients taking Truvada having a false sense of security about sexual behavior. It will also cause them to increase in STD transmission because they won't use condoms because they have that false sense of security. Studies have been very limited so far, but none of them have indicated that this is true. One study called the IPREX trial was conducted in the University of California in San Francisco, and it found that there was an overall decrease in sexual risk behavior among participants. They found that having the social interactions with other participants in the group played an important role in prompting safer sex choices among those people due to this medication. Another question that's been brought up is, should adolescents be allowed to take PrEP? I found several studies that had been performed in Africa, but not any that had been performed in the United States. One study studied 15 to 19-year-olds in Cape Town, Africa. This group included 99 girls and 49 boys. They were all 19 years old and sexually active. They all tested negative for HIV in the beginning. At the end of the first 3-month period, only 40% were still adherent to the regimen. And out of the first group, the 99 girls and 49 boys, at the end of the 1 year, only one participant had been diagnosed with HIV. There were only minor side effects that were noted with taking this medication, which was slight nausea and a headache. And that was the reason that the ones that dropped out of the study gave for dropping out of the study. According to the World Health Organization, the feasibility of using PrEP for adolescents is that it is safe and it's tolerable for this population. Dr. Catherine Gill of the Desmond Tutu Foundation presented her findings in 2017 that along with the drug, we need to provide a toolkit for students and young adolescents to be able to be educated about HIV and what they need to do to protect themselves. According to the Youth Risk Behavioral Survey, sexual identity issues are a leading factor in mental health problems. Any person of any age can walk into a health department and ask for birth control. Shouldn't they have the same opportunity to ask for a life-saving medication such as PrEP? Thank you.